It's Eli and Menzi Leicester with Khalema, brand new music on RB2, your station of choice. Now, I told you that they are back. They've been gone for a while, but I'm so happy to have them back. Guess what? Aid is in the building with First Things First, exclusive to RB2, your station of choice. They're here to let us know all about the products that they have and everything in between. Let's welcome Aid.
This is First Things First with Aid, your weekly guide to smarter healthcare, extensive benefits, and wellness that works for you.
100%. Let's welcome back the Aid Business Development Manager, Tsaone. Hi, Tsaone. How are you doing today?
I'm good, Mdu. How are you?
Happy to have you back is how I am.
Yes, we are great. Excited to be back in studio.
I love it.
Yes.
You know what I'm going to do? I'm going to sit down for a little bit.
Awesome. And you make me level up.
Yeah, I'm just like, oh, what's happening over here? But again, welcome you back to the show, ne?
Yes, it's a pleasure. We are excited to be engaging with our customers this time around.
Yeah.
And hello to our listeners as well as our Aid customers and the community at large.
100%. Now, because this is our opening show, we're starting the show strong by unpacking something every Aid member should know. How to correctly access services at your health provider. From validating your membership to knowing your health plan and using your benefits confidently. And now let's start at the top, right at the beginning. When a Aid member wants to visit a doctor for any healthcare, be it whatever really, what is the first thing that they must ensure?
We do have a couple of things that we expect our members to constantly or regularly be having or ensuring that they do check. Mainly the first one is your account. Is it up to date? Is your subscription up to date? Do you have updated KYC as our customer? And the third item is that do you have your membership number? Most of the time we just rock up to a service provider or your doctor to say, I'm here, I'm not feeling well. But you have to ensure that prior to making that knock at your doctor, you ensure that your account is up to date. This is one of the main validity of your membership with Aid. And then secondly, do you have your KYC updated with Aid? And then the third one is already reiterated, is your membership number. This allows the flexibility for your doctor to be able to check in terms of your account through the provider portal whether your membership is still active with Aid. So if you have checked all these three items, you are now good to go in terms of accessing medical service with your doctor.
We love it. Now, usually when we hear the term KYC as Botswana, collectively, because KYC, I want the KYC again, this. But please explain in context how the KYC in terms of Aid.
KYC, I think, is the latest jargon that has been thrown around. Basically, is know your customer. Everywhere, especially within financial institution where money is concerned, it's very important for us to have your updated details with us, especially when you are having dealings with Aid. So how does KYC look like as a Aid customer? We require that you should ensure that you have your Omang identification or your passport identification valid and updated with us. Your contact details, you need to ensure that your contact details, be it your mobile number, your telephone at work, or whichever preferred number that you would want us to liaise with you, your email address. Email. So you ensure that you constantly continue to update your details with Aid so that you don't have any lapse in terms of the communication that is intended to reach you. Also, your employer details or your employment details. Here and there, as and when you do that happens within your season, ensure that you notify Aid go company A, go company B, so that we continue to have the relevant or the most current information about you as our client.
They can just shoot an email, I guess.
They can shoot an email.
Okay.
Yes.
Okay. I like that. It's that ease of communication.
Absolutely.
That's very important. Now, tell me, once a member arrives at a clinic or a hospital, what exactly happens during the validation at point of service?
What normally happens is that when you reach your doctor, the first thing is that they want to confirm, are you on medical aid or not? Are you a cash patient or you are being funded by your medical aid? And if it's BOMAID, they would expect that you provide your membership number. You can produce your card to show that you are still a valid BOMAID member. You can give them your membership number. You can give them your mobile card. It's within your mobile app and show that you are a BOMAID valid customer with us. So with your membership number, the provider would go into the member portal. The provider portal instead to check if indeed that card you are holding is actually active. It will also present or give our provider an opportunity to appreciate the health plan that you are covered on, the number of dependents that you have, if at all you are bringing your child dependent or your spouse dependent, whoever and yes, and also check the plan that you are covered under. We've got a variety of health plans that we have, so they also need to appreciate health planning and also the availability of your benefits. As we are providing a service for you, do you have the benefits that would actually cover for the service the provider does or would be rendering to you?
Okay, if you're joining us right now, is BOMAID First Things First, back on a Wednesday right here on the pod on RV2, your station of choice. And today we're talking accessing your healthcare benefits. Do you know what your healthcare benefits are? Do you know the step-by-step process? Or what exactly is happening? Your BOMAID card number. What happens? How do they confirm? And how can you be sure and confident that you're covered for whatever service that you want? Tsaone is here to tell us the breakdown, step by step. This is what happens between you, BOMAID, and the doctor that you are seeing. Now, it brings me to my next point, the health plans. Why is it important for members to know and understand their plan?
We have 16 health plans. That's a huge array of benefits that we provide to our customers. So it's very important that at point of service, you actually know what exactly you've bought out of those 16 health plans. We've got your prestige health plan, your executive, your comprehensive, as well as your access. So as an individual, you should know within the 4 base health plans that I have, and beyond that, within my outpatient benefits, what level of cover do I have? Have I been covered on the core, the plus, the extra, or the mix? So if you are covered on Access Plus, then you'd know. Expectation is that you should know what kind of benefits are being built within Access Plus health plan. You covered for your consultations, for your medicines, for your optical services, for your dental, all the different parameters of benefits that we have. And for our different health plans, different packages in terms of the level of cover. It's very important to say, if you are covered for your consultation, how much of consultation is it? Because for your core, for your plus, for your mix, extra, they do have different level of covers. So it's very important to know what exactly your card covers you for, so that you already know what to expect. For this particular health plan, it does not extend to your hospitalization cover, because our access health plans are purely outpatient. So you should know more executive extra within hospitalization in for your outpatient. So it's very important that when accessing services, you need to know the health plan, the level of benefits, your benefits availability. So the power is within our customers. We have the member portal where you are able to explore further in terms of the different level of covers that are being provided for you, as well as your benefit availability as you continue to utilize your services.
Ghana, in that case, we should be able to check our plans. Say you are sick and you need to be an inpatient. It's easy for you to check your plan. Does my current plan give me the opportunity to do this?
Absolutely.
How do they check that plan?
So you on your membership card, behind the card, how it would show the health plan that you have opted for.
Okay.
Executive extra, it will show you are on executive extra. We do have the member portal. A Bomade customer can actually go into our website, www.bomade.co.bw, and then log in. You do register, and then you open an account. Then you are able to go through your membership. The same way we are seeing it behind the scenes is exactly what you'll be able to see as a customer. In terms of the health plan, you are covered on. Is your account active? It would show the different benefits that have been allocated within that health plan. It is super with the level of benefits to say, more executive extra. On an annual basis, we refresh the benefits. You have up to an overall basket there about around 1.1 million. So within that basket is then further broken down to say for consultation, hospitalization, these are the different levels or amounts that have been allocated to you as a customer. So as you continue to submit your claims, deduct from that basket amounts, and then it gives you an appreciation to say, three out of the amount deduct 3 services therefore so prior to even making a follow-up visitation to your doctor, you are able to preview to say, okay, benefits, therefore I can actually continue to access our medical services.
Okay, that's simple. Just on your website, www.bomade.co.bw.
Yes, you are able to get real-time benefits balances. You are able to check your plan details. You are able to even appreciate your subscription statement. Remember, initially I said the validity is also determined by that your account is up to date. So towards your medical aid, and even in terms of your authorization request, a guarantee prior to you being accessing the services. You are able to check has this service been authorized before and even update your KYC you are able, yes, within your member portal you are able to do that. This also further extends to the mobile app that we actually have. You can actually download it from Android or iOS, and then you are able to have your Bomade account at your confidence.
I love it. You heard it first on RB2, your station of choice. Bomade, health and happiness at heart. First Things First is back every Wednesday, and they're here to let us know all about their packages, how they can benefit you. And today we're talking accessing your health package and your benefits. And all you have to do is visit www.bomade.co.bw if you're a member, and check out the member portal so you can see your benefits, your health plan, your real-time benefit balances, plan details, subscription statements, authorization requests. You can even update your KYC right there on the member portal, so you can see just how the power that you have within your card, the power that you have within your membership. Now, before I let you go, Tsaone, how else can we get further in contact with Bomade services? And perhaps any last words?
All right, you can get in contact with Bomade physically at our offices. We do have an office, Fairgrounds, Gaborone, Francistown, as well as Maung. And then our contact number, call center at 363300. We also have a WhatsApp line. Our members can actually reach us on 762422. 1-3, or even go to other platforms that we have, our website, and get more information with regards to some of the services that we have. A word of parting is that we are back, and we shall be continuing these engagements with our customers for them to be able to appreciate how they can easily access services using the Bomade card. So look out for more educative information coming through to our members.
100%. Tlalanyane, the Business Development Manager at Bomade. Thank you for talking to us today.
Thank you so much, Mdu, and thank you to our listeners.
What a powerful start to First Things First with Bomade episode. And next week, we're getting into the conversation on subscriptions and payment referencing and remaining active on your health cover. So join us next week as we continue to bring you the tools and the knowledge to put your health and happiness first. Until then, stay covered with Bomade, health and happiness at heart.
This is the Pod. Weekdays at 12 to 3 p.m. on your station of choice.
RB2.
You've been listening to First Things First with Pomade. Tune in again next week. Same time, same place. Pomade. Health and happiness at heart.